Good morning everybody, Victoria Reynolds. I own Elysium Aesthetics Health and Wellbeing in Fakenham. This morning I'm just getting ready to do some laser treatments, and it got me thinking about combination treatments that I haven't made many videos about. So there's a lot of chat on social media at the moment about combination approaches, but actually combination approaches is something we've done in aesthetics for years. So I've worked in aesthetics since 2008. I am Save Face accredited. I've studied to master's level with Northumbria University in non-surgical aesthetics. I've taught and I've studied and I've performed research into aesthetics. And one of the things we've always done is combination approaches. Often people come in to see us and they'll come in because they want a consultation around Botox. We refer to it as neurotoxin. Botox is just a trade name of botulinum toxin, which we inject into faces and other areas of the body to reduce movement, which can smooth the appearance of wrinkles and lines on the skin and prevent them, and also relaxes the skin. But we do that often in combination with things like dermal fillers, skin peels, microneedling and other energy-based treatments. One of the things that I was going to talk about in this video is a combination approach for improving skin overall. So one of the things we use here is called PRP, and PRP is plasma-rich protein. What we do is we take a sample of our patient's blood, then we centrifuge it in this little device here. This one. This is a centrifuge. We take that blood, centrifuge it, and it separates the blood into 3 distinct parts. What we can do with that blood is either inject it back into the skin, into whichever area we're trying to treat. We can do that alongside other treatments such as laser resurfacing or skin resurfacing using microneedling. My favourite treatment for resurfacing is something that we talked about yesterday, which is the Gentlo. And this is the hand piece for Gentlo. This is the machine for Gentlo. And the main thing I use this machine for is radio frequency microneedling. So for every treatment I do, you have a single use microneedling head, which is powered by radio frequency using the Gentlo machine. So the Gentlo machine is powered by electricity. It converts electricity into radio frequency waves, which then goes into the skin via the microneedles, causes micro damage, and the radio frequency heats up the deeper layers of the skin at whichever depth we're trying to get to. And on top of that, either at the same treatment or a treatment further down the road, maybe 3 to 4 weeks later, we would use PRP. PRP is incredible for improving skin melasma, which is deeper pigmentation, skin tone. It helps to produce collagen 1, it strengthens the skin. We can also use it for hair loss or after somebody's had hair restoration surgery. We can also inject it into intimate parts because it helps with the skin tone there. But for the face, for tightening and toning skin, we can use that particular combination approach. So radio frequency microneedling, resurfacing with PRP, either at the same time, so we would put the PRP on without microneedling, or we would treat the face with Gentlo and the neck. We can do the neck as well, radio frequency microneedling, and then put PRP on as a topical because it will go through those little micro channels caused by the needles. Or we would get you back and inject the PRP separately as part of a combination treatment. So there's real evidence based behind using skin resurfacing approaches with PRP, and because there's a huge evidence-based part, not a huge one, a very stable and trustworthy evidence base behind this combination approach, is something that I would highly recommend for anyone who wants to improve their skin tone texture, tighten their skin and improve the look of dark spots, aging, wrinkles. It's very good for perioral wrinkles, orbital wrinkles, and obviously the forehead. When would I recommend this treatment? You could either have it as part of a Botox, neurotoxin pathway. You could have it on its own, or you could use it in a combination. So if you'd had lots of fillers or any fillers before, if you'd had toxins before, if you had skin peels before, you can always have this. PRP is suitable for any skin type and any colour of skin. Radiofrequency microneedling is also suitable for most skin types, but as with every treatment that you have here, you need to have a face-to-face consultation so that I can assess your suitability for this treatment, or recommend something else, or refer you on. Okay, I hope that's been helpful. I'll do some more information about PRP, and it's so incredibly useful and safe, because we can use it on any area of the body. So if you're interested in any of these procedures, give me a call. Go to elysium.life. My phone number is on there. The contact page will take you to my WhatsApp, and I look forward to hearing from you soon.